Hello everyone, this is Dr. Abhinav Singh from SBK's MI and RC. I'm here to present my paper on topic B-scan, a significant tool in evaluating various ocular lesions and its merits over conventional ophthalmoscopic examination. The introduction highlights a sonographic study of 118 patients. This study emphasizes the advantage of ocular sonography or B mode for evaluating retinal disorders, particularly in patients with opaque ocular media or trauma. The advantages of ultrasonography or B scan are that it is rapid, safe, reliable, non-invasive, and non-ionizing. It offers a real-time display of moving organs and has high sensitivity and specificity of ocular pathologies. It is particularly useful for preoperative assessment of posterior segment when fundoscopy is challenging due to trauma or opaque ocular media. The aim of this study is to evaluate the role of USG in cases where direct vision by ophthalmoscopy is impossible, such as with opaque media or trauma. Additionally, it aims to assess the USG role in orbital diseases and in localization of intraocular foreign bodies. In materials and methods, 118 patients with suspected intraocular or orbital pathology were included. A linear probe with frequency of 3 to 12 MHz was used. The selection group consisted primarily of patients with fundoscopy was challenging or those with blunt trauma or proptosis. The examination was performed with patient supine and transducer held over a closed eyelid using coupling jelly without corneal anesthesia. Both eyes were scanned serially in transverse and sagittal planes, with the patient moving the eyeball to better delineate anatomy and lesion mobility. Next, we delve into observation and analysis of data collected. Analyzing the age distribution, the highest number of patients, that is 24%, fell into the 31 to 40 age bracket. The sex ratio observed in the study was 64% male and 36% female. Looking at presenting complaints, the most common was diminution of vision, that is 48%, followed by trauma at 20%. For indications for orbital ultrasound, opaque media was the most frequent region, accounting for 62% of the cases, followed by trauma at 21%. Among the causes of opaque media, lens opacity or cataract was the most common at 58%, and vitreous opacity was next at 36%. Regarding the incidence of pathologies, vitreous hemorrhage was the most frequent finding at 30%, followed by retinal detachment at 25% and endophthalmitis at 15%. In cases specifically related to trauma, vitreous hemorrhage was the most common pathology at 43%, with retinal detachment followed at 28%. For retinal detachment cases, 65% presented as complete detachments and 35% as incomplete. The appearance of vitreous hemorrhage was most frequently seen as a localized collection, representing 41% of the cases. The table displays the statistical analysis of various ocular lesions showing high specificity and sensitivity values for conditions such as retinal detachment and vitreous hemorrhage. The bar chart visually represents the specificity and sensitivity, positive predictive value, the negative predictive value for the listed ocular pathologies. In summary, orbital pathologies were predominant in third to fourth decade of life, and the male to female ratio was 2:1. Diminution of vision and trauma were the chief complaints. Less opacity was the most common cause of opaque media. Retinal detachment showed a 97% sensitivity and 100% specificity. Furthermore, 62% of USG referrals were due to opaque media. USG aids in localizing foreign bodies and demonstrating the dislocated lenses posterior aspect and associated abnormalities. Next, we will discuss several illustrative case images. This image illustrates vitreous hemorrhage, which is characterized by diffuse vitreous echoes in the. Here we see a V-shaped band indicating retinal detachment, clearly showing its attachment at the optic disc. This scan of endophthalmitis displays diffuse vitreous echoes and visible thickening of choroidal layers. The axial sonogram here demonstrates a lens that is dislocated posteriorly, often the result of a penetrating eye injury. This image of thysis bulbi shows a small, deformed, shrunken globe accompanied by a calcified cataract. The axial sonogram for vitreous detachment reveals the posterior surface of the detached vitreous as an echogenic line which is not attached at the optic nerve head. A foreign body in the eye is visible here as a hyperechoic focus within the vitreous body. This USG scan of coloboma shows a defect in the posterior wall of globe with herniation of vitreous. Choroidal detachment is characterized by diffuse vitreous echoes and a convex band of detachment that is not attached to the optic disc. The sonogram of a choroidal melanoma shows a large round tumor, a common appearance for this type of malignancy. In a case of retinoblastoma, USG reveals a heterogeneous soft tissue mass with specks of calcification which produces acoustic shadowing. This image of a cataract shows that the normal lens is not visualized. A thickened ovoid echogenic mass is seen representing a mature cataract. In conclusion, B-scan USG provides excellent real-time imaging of various ocular pathologies. It is a non-ionizing, cost-effective, and non-invasive technique that can be performed on outpatients. It is particularly valuable for evaluating retinal disorders in patients with opaque media or trauma where fundoscopic evaluation is impossible. Here are the first set of references used for this video. This slide lists the remaining references. Thank you so much everyone for listening to my presentation.